The fifth point against government regulation as a fix for our healthcare problems. The House bill includes a requirement, in other words, a mandate, that every citizen purchase a, quote, qualified health benefits plan, a QHBP, of a certain type. There are exactly 4 types allowed under the House bill, with specified deductibles and copays, all as determined and priced by the Secretary of Health and Human Services. Putting aside the constitutionality of this requirement, it will cause, first of all, premiums to increase substantially. We can assume that all QHPBs will be required to cover all things. Notice the recent kerfuffle over mammogram recommendations issued by the United States Preventive Services Task Force. To comfort women when that scandalous report was issued, Secretary Sebelius was quick to assure us that the final decision about such coverage would be up to her or her successor. Okay, tell me, please, exactly which disease or malady will not cause a similar uproar if the future task force recommends against treatment of that malady? Which sickness will not be covered by government-sanctioned QHPBs? Which Secretary of HHS will deny coverage to some to-be-determined unfortunate sick Americans? Which secretary will form the no mammograms panel? Isn't that sort of like a death panel? That secretary, of course, will never hold that office. That heartless secretary nominee would never survive Senate confirmation hearings, right? Hence, all patients will have only the best, most comprehensive, 4-sizes-fits-all policies. And since medical care doesn't grow on trees, absent a system that's tantamount to slavery, that is, a very much larger group of healthcare professionals than currently exists will have to be compensated to provide unlimited care to 100% of the population. Sounds pretty expensive to me, don't you think? So, since we know it's too expensive for everyone to have everything, what will happen instead is number 2, a severe shortage in medical services if prices are artificially made, quote, affordable by the government. While the authors of this bill seemingly ignore it, Congress cannot repeal the law of supply and demand, which, like the law of gravity, isn't just a law, it's a damn good idea. Artificial price controls will, like night follows day, produce a shortage in the supply of the thing we want more of, quality care. Imagine the 53-year-old seasoned general practitioner. Her children have graduated college. There's no mortgage on her home in Bethesda or the beach house in Boca Raton, and she has an IRA with a balance of $2,153,000. I know she and thousands of her peers will retire. They're irreplaceable. The med student one might be thinking about as her fill-in is already in the system. Her retirement is a net loss of talent, and there will be a severe shortage of medical professionals. There's only one solution to that economic condition: rationing. Political rationing. Not rationing by price, rationing by power and force. And the language in the bill purporting to prohibit rationing doesn't even qualify as wishful thinking. It's an insult and a blatant deceit. And now a 6th point about government regulation in the healthcare business. This bill's sponsors pretend to know, yes, know with absolute certainty, the unknowable. And the country is asked to base monumental life and death decisions on the outcome of their studies. There's much discussion about the Congressional Budget Office scoring process that purports to estimate the cost of this entitlement bonanza masquerading as legislation. There are very, very few explicit appropriations in this bill. Instead, there is a list of a complicated set of standards that the CBO uses to estimate their cost. That list of things includes: 1. How many people will be entitled to a subsidy? 2. How many people will pay penalties and taxes? And how much will those penalties and taxes be? 3. How much a QHBP should cost based upon an 18-month study that the government conducts using all of the historical data given to them by the private sector. 4. Which existing insurance plans will be grandfathered? Answer: only those that remain perfectly, totally identical to their existing policies, a economic and practical impossibility, by the way, so nothing will be grandfathered. 5th, the effect of the government forming an independent competitor to participate in the insurance industry. Yes, the public option is still in the House bill. 6th, which healthcare services will be required to be covered under a QHBP. And lastly, the determination of the right and affordable price for all of the above. A 7th point that argues against government regulation. If this bill passes, there will be virtually no innovation in medical sciences. As soon as they pull their nose out of the government trough, any rational pharmaceutical or healthcare company will declare a liquidating dividend to their shareholders. It will be equal to the reserves they're holding for R&D for the next 3 to 5 years. The government is essentially taking the products of that R&D and nationalizing it. The government in turn, a government task force in turn, will deliver those products to the market at an arbitrarily determined fair price. In fact, thinking about this bill as a creative and abusive use of the power of eminent domain is one way of evaluating the constitutionality of the bill. So why would a drug company dare expend shareholders' capital for R&D when there is no means of predicting a reasonable return thereon, when they will not own the resulting inventions or products? The companies will liquidate. There's more, but anyone not convinced so far, or already, is hopeless or a member of the Obama administration. In short, capitalists can win this debate by exposing the false choices offered by the self-described progressives. The pink ribbon on the White House is the Obama administration's unknowing confession that Obamacare is at its core a lie. Their ever-changing defenses of their reform package present a false choice in that they ask and answer the wrong questions and pretend that there is, after all, a free lunch. How do we get more quality health care for more people? Do we want the price of the most important thing in our lives to go down? Let the profit motive work its magic and watch the flood of quality product for customers. Buyers of health care are not terribly price sensitive and are very eager, to say the least, to buy life-saving products. An eager customer that's not price sensitive. It's a dream for a capitalist. The market will drive the price of health care down, 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 and the customers will demand and get more and more and more. Remember that bottled water was on my list a few times at the beginning of this discussion? There's a reason for that. Think about water. Think about how we deliver that absolute necessity to consumers in the marketplace today. Think about the airport. You can go to the airport and drink as much water as you want for free, at no additional cost, from the water fountain. Or you can go to the gift shop and buy 16 ounces for $5 or $6. Have you ever seen a line at the water fountain at the airport? No. We can do better. May God bless America.